Pleased to introduce to you someone who's been a thought partner of mine for a long time. Many of you know Ken from his days as a founding executive at the Seneca Center, and then I think it moved to Seneca Family of Agencies, a longtime champion for child and family services. He can tell you a little bit more about himself. He is now the president and CEO of Just Advocates, and Ken's going to talk to us for just a few minutes about universal service array and workforce development. This is timely. If you're familiar with the SAMHSA, the Substance Abuse Mental Health Services-based research on system of care, you know that they added a couple of new principles or values to their definitional foundational documents, one of those being comprehensive continuum, acknowledging that only in interagency work can we develop the capacity together. So they've actually put this into their values list in the last couple of years, and Ken has been a passionate pursuer of this in his work throughout his whole career. So welcome, Ken Berrick.
Morning. Oh, that was, especially after what you just heard, that was weak. Morning. You know, I'm adding a new rule to my rules for public speaking. The new rule, the rules before were never try to make a speech after Martin Luther King, never try to sing a song after Barbra Streisand, and now never try to come up after Saran speaks to, and a young person that's that inspiring and that whose leadership we can see is going to shine for a very long time. So just get used to it. Get ready to be bored. I'm going to just talk to you. And I want to talk to you about a few things, but the biggest thing I want to talk to you about is opportunity. And how many of you, actually I want to tell you, I had a friend who used to come into the room. He was the most obnoxious guy in the world. He'd come into the room and we'd say, "What have you been up to?" And he'd say, "If you're not jealous, you should be." Really, you know, kind of guy you want to hang out with. So I'm going to modify that for this, which is, how many of you feel overwhelmed by the speed of change that's going on right now? I saw, she went, "No, I'd like to get to know you a lot better." Okay. If you're not overwhelmed, you should be. I've been doing this for a little while, even though I'm only 35 years old. What? And I have never seen anything close to this speed of change. Nothing close. Some of you may have experienced it in pockets. When 3632 came along, there was this burst of change, but never across all systems at the same time at this speed of implementation. I have heard from my colleagues so many times. I'm looking at Camille, who's in the middle of all of this. You're not overwhelmed, though. You look very calm, Camille. I've talked to my colleagues who have said, "Does it have to be this fast? Do we have to roll?" Have any of you heard that? Do we have to roll this out this fast? And I have taken a minority opinion on that. And the answer is, I think we do. I think we do. We have a window of opportunity that we will certainly never see again in my lifetime. We have leadership in the form of a governor that cares about our issues, and we have people that are trying to implement this at the speed of light so something actually gets done. And you're those people, and I applaud you, and I applaud you for adapting to this speed of change. And the speed of change had its roots set for a long time. So starting in, I think it was 2016, we convened a high needs youth forum. And in that high needs youth forum, we set out the beginning of an array of services for high needs, the highest needs youth in the system. And as we worked on setting out that array of services and then followed that up with a more detailed discussion of that in the Child Welfare Council, we realized something important. Somebody help me with what's wrong with detailing first a high-need system of care. This is call and response, people. I will wait or I will call on you. Say it. It's siloed. Okay, and what else? It ignores prevention first. You cannot build enough high-need services for kids and families in California if you don't have a preventative system that allows you to serve kids so that they don't have to move to that level of service. It can't be done. You can't build enough beds. You can't build enough day treatment spots. You can't build enough wraparound programs. It cannot be done. We've proved that definitively. We've proved it over and over again. So after that, I got the privilege to work with Karen Larson, who's going to be up here in just a second, in the Child Welfare Council to do something that we called the universal array of services. And the universal array of services put at the back end of it the high needs services that we had detailed in the earlier efforts. But it also said, here are all a full array of services that you should be able to implement from top to bottom. And in that universal array, we all got to have a laugh. Because when you looked at the universal array, there were funding sources for there's a funding source for hospitals. There's a funding source for day treatment. There's a funding source for segregated non-public school with mental health. There are funding sources when kids get so sick, so hurt, so troubled that they can't be served in any mainstream setting. Most of the universal array did not have a funding source. We're not going to talk to you about anything new today. What we're going to talk to you about is the opportunity that the ecosystems paper that Breaking Barriers did with Children and Youth Behavioral Health Initiative then led to a series of decisions about how we're going to fund services that think first about preventive services. And the starting place that I want to ask you to come away from this conference is I've looked at each service that I think is necessary on the preventative side, and I believe that there is a way to fund virtually everything that we've wanted to do for a lot of years. And it's going to take a tremendous amount of collaboration, and it's going to take a tremendous amount of advocacy to see the vision become a reality. But for the first time in my career, I see the possibility of that reality. And so I want to introduce Karen, who's going to present with me, who worked with, we led the effort of probably 200 people, youth, families, practitioners, looking at what are all the elements that could be in a universal array of services if we ever had a funding stream, so that instead of it being Fantasy Island, it's reality show. Okay? So that's what I want you all to hold as we talk through these things today.